All right, this is my patient Luz. This is her last day. When I met her, she had pretty severe debilitating pain. Stand up for me. Face that way. So she had pain, in the SI joints, and she had buttock pain, and also it came down a little bit, right? And she basically hobbled in here and had failed everything. I'm gonna let her tell you in a second all the things that she's done. But what actually happened to her is that she had an upslip of her pelvis, an out flare, and her sacrum was torsioned like this, and that causes a shearing at the base of the spine, and it can also cause buttock pain down into here with the sacral torsion. And I realigned it, and instantly we got her out of pain, and then it took a few months, and we stabilized it, and now, go ahead and arch back for me, please. And now she just drove here an hour, and she couldn't drive. Her husband had to drive her, and she drove here an hour, and she said that she's good, and she can arch back and bend forward for me. Go ahead and bend forward. Yeah, no pain, and yep, and go back. Yeah, she doesn't have any pain anymore. Now, what I want to have a seat right here for me. So this gets misdiagnosed all the time because I call it the invisible injury because it doesn't show up on an X-ray and MRI. So she has people with this condition can have sciatica-like symptoms. They can get hip pain, they can get groin pain, they can get pain down their leg, all the way down their leg, but it's actually not true sciatica. It's this joint that goes out of alignment in their back. And what I asked her to do before we turned on the camera here is I asked her to talk a little bit about how debilitating this condition is, because I don't think people realize how debilitating this condition is. Go ahead. What have you had failed basically everything. She went to physical therapy twice. Pain management doctor was injecting you because they said it was a disc, because they found a disc on an MRI that was herniated, and they said this must be it. Yeah. But in reality, it was this condition, right? Go ahead.
All right. So, for example, I guess the main thing is the pain, the amount of pain that you experience, right? So, like, it's hard to describe when you say here that your pain is here, they immediately think it's your piriformis, right? But my pain was in here as well, like way inside like your butt. And that pain is so excruciating that you can't think. You can't think, and I couldn't sit, right? So I couldn't sit because the pain was too much. So things that you cannot do, right? At home I ate standing. So I had a bar, so I would put my plate there and I would sit. I would just eat standing all the time. The couch, for the first time 2 weeks ago, I was able to sit and watch TV on my own living room. My husband hasn't seen me sitting there for a year. So those are the things that, that you can't do. Getting in bed. So if you have to get in bed, this motion has to happen for you to get in bed. So my husband would pick up my leg so that I could get in bed. So I couldn't get in bed either. When you go to the bathroom, when you sit and go to the bathroom, all those muscles you gotta use. So I will have to go like this to sit on the bathroom and hold myself into the counter so I can lift up to get up from the toilet. So those are the things that people don't realize, that it takes a toll on your life, because normal activities that you could do before, you couldn't do anymore. And that's the main thing. And it just gets depressing. And because you are in so much pain, you can't think straight of what your solution is, what is next. Medication doesn't help. When they did the piriformis injection, they took me off the table, they put me on a wheelchair, and the pain was excruciating, but I couldn't even stand up from the wheelchair where I was at, because the piriformis injections, your whole leg goes numb. So, and then they did another injection because it was my L4, L5. Immediately I felt the pain. The pain management medication didn't help me at all. It was worse because I felt worse, and getting off of it was horrendous. And but
the reality of it was it didn't show up on an X-ray and MRI like most of my patients. And most of my patients have been to all these things, and a lot of them have had surgery, and they come in here and I realign what I just showed you, and their pain's gone in 30 seconds, and this was the cause of it. So this is, I wanted her to tell her story because this condition is totally debilitating, and 57% of my patients have contemplated suicide over this condition, and it's just horrific, but it doesn't need to be that way. I'm trying to educate my colleagues and the whole nine yards.